Dr. Laurie Jacobson of Pacific Dermatology and Cosmetic Center in Seattle says skin cancer is more common than you might think.
It's the most commonly diagnosed cancer in the United States, and there are 3.5 million cancers diagnosed every year here. The good news, though, is skin cancer is, for the most part, highly preventable and easily treatable as long as it's found early.
So who's at highest risk?
People who have fair skin, I'm looking at you, Art, blonde hair, blue eyes or green eyes, lots of freckles, people who have had a lot of UV radiation, whether that means from a tanning bed, and also if you're out in the snow, like we skiers like to do in Washington, or go hiking, you're at higher altitude, and that puts you closer to the sun's rays.
But don't be fooled. Dr. Jacobson says cancer is colorblind.
And while it's more common in people who are Caucasian, people who are African American at risk of getting something called acrolentiginous melanoma, which is very deadly.
So how do we protect ourselves?
The easiest thing you can do, and even living in Seattle where it's sunny only 50 days out of the year, is to wear sunscreen every single day. You're actually getting 80% of the sun's rays on a cloudy day. And then we think about things like protective clothing, broad-brimmed hats, sunglasses. You want to avoid tanning beds at all costs. You really do. A 75% increase in melanoma with tanning beds.
When it comes to sunscreens, it can be confusing. What about those 100 SPFs? Don't they offer more protection?
Above a 30, you're not getting that much protection. A 30 gives you about a 97% rate of protection, whereas a 50 only gives you about a 98% level of protection. So you'd think, oh, SPF 60, it's got to be double 30, but it's actually not, which is why if it's above 30, that's great, but you don't need to go higher.
So protect your skin and get out and enjoy the great Northwest weather. Art Sanders, KOMO News Radio.